doctor speaks. Yeah, brain doctor speaks. 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 Yeah, brain doctor speaks. This video is for entertainment and contains the opinion of Brain Doctor Speaks. Anyone watching should always consult the advice of their own primary care physician or specialist for diagnosis or treatment.
Hi everyone, I'm Brain Doctor Speaks. Thank you for joining me today. Guys, look, COVID-19 is no joke. And let's start out with some housekeeping information. If you like this video, please subscribe, click the like button, click the notification bell, and share the video. Thank you. Okay, everyone, so this is my take on COVID-19. I am a neurologist. I'm a board certified neurologist. And so, of course, a lot of us have been hearing about COVID-19 from infectious disease specialists, internists, hospitalists, cardiologists, even emergency medicine physicians. But I too have my own take about COVID-19. As a neurologist, I had to go to medical school just like all these other physicians with various specialties. And so we had to learn about not only infectious diseases, but along with that, we had to learn about epidemiology and public health. And so I do have a good breadth of knowledge from a professional standpoint to discuss this issue. And so COVID-19, the novel coronavirus that was discovered in 2019, is again a virus. And so it's important for folks to know that with viruses, a lot of times treatment for viruses is supportive. And of course, that's how it was when COVID-19 first hit the world and became a pandemic or created a pandemic. And so what we must know about viruses is that they have to have a host. So in this case, the host for COVID-19 most overwhelmingly is human beings. And I say that because some viruses, of course, can be transmitted through dogs, ticks, mosquitoes, various other hosts and vectors. But it's important for us to know that COVID-19 couldn't even be transmitted if it could not be transmitted from human to human. So how are viruses transmitted? Well, this particular virus is by large and far transmitted via respiratory route. So what I mean by that is either from someone breathing, coughing, sneezing, laughing, talking, someone who is infected with the virus, and then they release that out into the environment. Well, if someone is close enough to that infected person, then they can be exposed to the virus. So this is one reason why we have discussed, and particularly early on in the pandemic, about social distancing. If you stay in your house or you are many feet or yards away from someone, then you cannot transmit the virus. And so there's been debate as to whether, even more specifically than just saying that COVID-19 is primarily transmitted via respiratory route, there's been some debate as to whether it is transmitted by respiratory droplets or respiratory aerosols or airborne transmission. And so what we mean by droplets is that if the virus is large enough, it cannot transmit for many feet and many yards. So in general, someone's just sitting here talking, they're not sneezing or coughing, then typically those virus particles will quickly fall and not transmit past 6 feet. So that's what we mean by droplets. So that's when the virus particles are larger. But if someone is actively coughing, if they're actively sneezing, those virus particles can be transmitted even further, and many more of those virus particles can be released out into the environment. And so that's what we mean more by aerosol or airborne exposure. So another point that I want to make about as far as transmission, and so we do think that while respiratory transmission is the predominant route of transmission or mode of transmission for COVID-19, it can be transmitted some on surfaces, and one of the biggest surfaces is our hands. And so in addition to social distancing and masking, it's really important for us to wash our hands properly. And not touch our face, our mouth, our eyes until we've thoroughly washed our hands. So let's talk more about how to prevent transmission of COVID-19. So we touched a little bit about social distancing, staying away from groups of people, staying in your house, when you're out, staying at least 6 feet away from people. But another big part of this, of course, is masking. There are different types of masks, as most of us know now. We have cloth masks, regular surgical masks. We have the N95 mask that I think all of us can generally purchase now. And then we have N95 masks. And so I would say in reverse order is the degree to which those various masks can protect you against COVID-19. So the N95 mask is one that typically can only be accessed by healthcare professionals. And typically these days only if someone has been either confirmed to actively have COVID-19 or is highly suspected to have COVID-19. And so in those instances, we as medical professionals, when we are taking care of patients, will wear an N95 mask. The N95 mask is the best type of mask really that we have to protect one against contracting COVID-19. And those masks can be very hard to wear. They can be hard to breathe in. They can be hard for other people to hear you because they fit the face so tightly. You may have seen some videos, infomercials on TV where you see the nurse and she has all of these indentations around her mouth and across the bridge of her nose. And that's because she had been wearing an N95, he or she had been wearing an N95 mask for hours, taking care of patients with active disease. And then we have the KN95 mask, which is what I have started wearing on a day-to-day basis because those masks are less expensive. They're more easily accessible to the public, and they also are probably the next step down from protecting against transmission because they fit closer to the face, particularly if you try to seal over the bridge of your nose than a regular surgical mask. So a regular surgical mask also has several layers that helps filter out virus particles, whether virus particles from the person wearing the mask or virus particles that could be coming towards someone who is wearing the mask. But those, again, don't fit the face as tightly as KN95 mask, although there are things that you can do to tie the loops, the ear loops, to make them fit closer to your face and not have so many gaps. And then of course we have our cloth mask. There can be various degrees of cloth mask, whether they have one layer, or 2 or 3 layers, and how tightly woven the cloth fibers are. But I would like to say I feel that any mask is better than not wearing any mask because if you have less particles that you transmit when you talk to somebody or you laugh or cough, and then if the other person is wearing a mask, then they have less particles when they talk or laugh or so forth. So it's just really important for us to protect each other. So another point I would like to touch on, and so this is something that I would say is probably one of the least misunderstood aspects of preventing COVID-19 infection among the general population. So there are instances where you would also want to wear eye protection. This is kind of a standard thing now in the medical field because we can't social distance from our patients, whether we're in the office or in the hospital setting, evaluating and treating patients. And so we also know, again, that COVID-19 can enter in through other mucous membranes besides mouth and nose, and primarily the eyes, the mucous membranes of the eyes. And so you can also get additional protection by either wearing a face shield or wearing large goggles that cover your eyes. Regular eyeglasses are not considered adequate covering of the eye. And so we do in the medical field during this Delta surge in particular, all are encouraged and really required, probably in most places at this point, to wear some sort of eye protection. One misconception about eye protection that I would like to clear up, because we've all seen various people who say that they don't want to wear a mask or they can't wear a mask, and we see them wear a face shield. Well, a face shield does not take the place of a mask. Again, the face shield really helps further protect you when you are wearing a mask so that you don't get particles, virus particles from someone in your eyes. All right, so let's talk about symptoms of COVID-19. So I think everybody at this point knows that the most common symptoms that people can get from COVID-19 are respiratory. Problems with cough, shortness of breath, but people can get fever. They may not have a fever. People can get chills. They can get body ache. And so I really want to emphasize that this is not just some run-of-the-mill cold or flu. It's true, there are some people who, no matter what variant of the disease or whether they have been vaccinated or not, may have pretty mild or minimal symptoms. But we see the range of minimal symptoms to quite catastrophic symptoms and even death. That is a fact. Again, I'm not going on what the media says. I see this personally as a physician, and I have access to various physician groups where physicians and other people have accounted in great detail their symptoms from having contracted this disease. So another point that I would like to make is that we don't know who may have severe symptoms and who not. It's true that for a disease like the flu, where most of us have developed some sort of immunity against, not only because of a lot of us being able to get vaccinated against the more common flu strains annually, but there are various reasons why a large majority of the population has developed immunity against flu strains. But COVID-19 was totally new. There was hardly anyone with any immunity when this disease hit. And so initially we were told that those who were older, those with certain chronic health conditions like diabetes or hypertension or obesity or asthma, were much more likely to develop severe symptoms and run the higher risk of death potentially from COVID-19. But we know now that we can see catastrophic outcomes from people of all ages, and we can also see minimal to no symptoms in people of all ages. But unfortunately, we've seen younger and younger people, not just elderly, but us middle-aged folks, and unfortunately, even younger groups of people. So we use this term Russian roulette. I feel like we're playing Russian roulette by just assuming okay, I'm a healthy person or I'm a young person. So I'm thin, I'm in my 20s, I don't have high blood pressure or diabetes or asthma. So if I contracted this, I'm not going to contract the disease. Or if I contract it, I'm going to have minimal to no symptoms. So I'm not going to get vaccinated. I think that's an extremely dangerous approach to take. I would also like to share with the public that there are various other conditions or symptoms or presentations of COVID-19 besides respiratory. So, we see people who end up with heart attacks because they form blood clots and arteries around the heart. We see people who end up with inflammation of the heart muscle, what we call myocarditis, which can weaken the heart muscle. And then we also see the other major organ system that I would like to touch on is the neurologic system. So the nervous system. So I personally, as a neurologist, have seen people who've had devastating strokes because we believe, at least in part, that COVID-19 can cause what we call a hypercoagulable state. And that means that people can develop a tendency to abnormally form blood clots. So unfortunately, I've seen people have devastating strokes as a result of COVID-19, where things just happen so quickly that despite our best efforts, we're not able to reverse those changes that have occurred in that particular person. Other neurologic manifestations of COVID-19 that we can see are cognitive, meaning problems with thinking and or memory. And that can be in the form of what we call an acute encephalopathy, where the person becomes confused shortly after contracting the virus, or they can have problems with thinking and memory that we can see weeks and even months out from contracting the virus. And of course, we don't have any specific treatment for any of these things. Some people can have headaches that can be prolonged. And again, they can have constant headache to episodic headaches that can go on for weeks and months after contracting COVID. Other neurologic manifestations that we have seen are that people can get acute nerve damage, where they quickly, over hours to days, can start to develop weakness in their limbs, even perhaps their breathing muscles, which can be yet another route or mechanism by which someone can develop respiratory failure from COVID-19. And then another thing that I have seen as a result of COVID-19 from a neurologic standpoint is we've all heard unfortunate stories about folks who, despite being in the hospital and being on the ventilator and getting the most aggressive treatment to support them with their breathing, don't make it. And so one of the things that we can see is that despite best efforts, despite having someone on the highest ventilator settings, after being intubated due to COVID-19 pneumonia, they still don't get enough oxygen to their brain for a certain period of time. And so that can cause permanent brain damage, which we call a hypoxic or anoxic brain injury. And that can cause people to have devastating confusion long term. It can cause people to become in what we call a vegetative state or a coma. And even unfortunately, that can even cause someone to become brain dead. So there are just so many unfortunate things that we have seen as a result of this disease. And so this is why I'm just really urging everyone to seek appropriate measures to prevent either contracting COVID-19, transmitting COVID-19, or having severe disease if one does contract COVID-19.
Brain Doctor Speaks. Brain Doctor Speaks.